Hello, welcome to VMC. I'm Dr. M. Today we are going to dive into the topic of separation distress and what you should do about it. So join me, you'll learn something today. Let's cover treatment for separation distress. Now, this will depend a little bit on your individual animal, and it will also depend on the severity of the symptoms. If the distress is mild and or only occurs for the first 30 minutes or so after you are away, it's often successful that with increasing enrichment, giving them things to interact with while you are away, and working on some counter conditioning, that we can often get these animals to learn how to be relaxed when they are home alone. So counter conditioning is the behavior modification process that is used via a training plan in order to change how the learner is feeling about a particular situation. So we want to change them from feeling distressed and anxious to relaxed and able to sleep, ideally. Now, it's crucial during the entire counter conditioning process that the learner stays under threshold. If they at any point experience a significant amount of distress, then their brain is unable to learn, and it is another situation where they were incredibly upset and distressed and anxious that will make their future behaviors more challenging to modify. It's absolutely crucial that we are not asking them to do more than they are able to. That means very, very gradual exposures in a way that teaches the animal that good things happen even if the person isn't around. So using stuffed food puzzles, using higher valued treats in those food puzzles, making sure we're meeting their enrichment needs first before we go, whether that's training sessions, physical exercise, absolutely always some brain exercise. We can also use things like relaxing music. We have some research that classical music can be relaxing for some dogs and cats. I think of things like Through a Dog's Ear. There are also some channels on YouTube that you can play, Relax My Cat and Relax My Dog, and those can be helpful. We also need to implement a predictable routine, because when the animal knows what to expect and when, that does make things easier on them, and it makes it easier for them to relax and feel secure in what's going on in their home environment. We can also consider diffusers like Adaptil for dogs and Feel Away for cats. Be mindful they're only effective for a certain square footage of house, and the research isn't incredibly strong for some learners. It does seem to be helpful, so it can be worth giving a try for these animals that have mild separation distress. We can also use the supplement Zilken that has tryptophan and casein in it, both of which can help to promote some relaxation. We can also use prescription diets like the Royal Canin Calm. Those can help with mild anxiety or stress. Purina also has a calming care probiotic that can be helpful for some pets. When we have patients that are feeling milder distress or anxiety, these sorts of tools can be helpful to promote relaxation as those animals are learning and going through the counter conditioning process. There are going to be a number of patients that have moderate to severe separation distress. For these patients, all of the things that I've already listed might help some, but they're not going to be enough. This is because the brain of these animals is experiencing so much panic that it's literally unable to learn. Just think about if you were somewhere where you were feeling like you were about to die, you would not be able to learn a new math formula because your brain is fully panicking. And that's what's happening for these animals. So in addition to doing the things that I already have mentioned, we need to be consulting with a veterinary behaviorist. A veterinary behaviorist is a veterinarian who has graduated vet school and then gone on to do years of additional training and written a licensing exam to become a specialist in behavior modification. So they can prescribe medications to help reduce distress, anxiety, fear. They can also help with very specific and specialized counter conditioning and desensitization plans. It's likely you're going to have to start the training process with the predictor cues, those things like grabbing keys or picking up a jacket, that the animal already starts to feel some anxiety and distress when they see you doing those things. So the training process actually needs to start well before you've actually tried to leave the house. And it's also going to be incredibly important that during the training process, the animal never feels like they have gone over their threshold. We would expect for them to experience some very mild stress at some points in the training process. It can never be significant enough that they are showing anxious behaviors. You can only progress with the training plan when the learner is not experiencing any anxiety at the current step. And so this requires splitting behaviors down into incredibly small steps and very, very gradually working your way through the training plan. Having calm and quiet departures and arrivals can also be helpful. That way you're signaling to the pet that this is really not a big deal. And while working on the training, no matter how severely affected the learner is, you must avoid all distressing situations. This means you might have to take your dog with you, or it might mean that a friend or family member comes over while you are away, or that you hire a sitter to stay at your house while you are away. And cobbling together a plan out of all of these solutions is necessary. I also hear from many people that they don't want to medicate. This stigma bothers me immensely. If your animal needed medications for their thyroid or they needed insulin because they're diabetic, you would medicate them. The same goes for when their brain needs medications, so that their brain is able to learn the counter conditioning training plan that you are going through. Without that medication, their brain is just in a panic, fight or flight mode, and the likelihood that you will be successful in modifying how your animal feels is very low. We have to address how the brain is feeling and reduce the anxiety enough that it's able to learn. Some research on separation anxiety was very clear that the combination of prescription medication and behavior modification is the most successful. So please, please, please stop the stigma around medicating our pets. Once we have been through the training plan, we can try to wean down the medication that they're on. Some animals can even come off of the medication that they're on. But if they need long-term medication, so be it. That is okay. In summary, animals doing destructive and disruptive behaviors when you are gone are not being malicious. These animals are experiencing so much fear and upset and anxiety and distress. They are panicking. This is a place where we need to be incredibly patient and empathetic and work hard to address that distress so that we can improve their quality of life. It's worth the work to do this, and when approached well, it is generally incredibly successful. So please check out the video description. I will link to a blog that helps to find positive reinforcement dog trainers. I will also link to the website to help you find a veterinary behaviorist. And there are also some dog trainers who have some online consulting that they can do. If you have a topic that you would like me to cover in the future, don't hesitate to leave a comment. I'd love to hear from you. And if you have any other questions, feel free to leave them down below. I will answer the ones that I am able to. I do put out a new video most Fridays, so I look forward to seeing you in the next one. Bye for now.